in listen-only mode.
Good afternoon, everyone. Welcome to the RPG meeting for June for the Texas Balanced State Continuum of Care. I'm Mary Ricklick, the CoC manager here at Texas Homeless Network, and I've got other THN staff in the room, and I'd love for them to introduce themselves.
I'm Sophia Cheka, the Systems Change Coordinator.
Hi, this is Lindsay Marsh, Data Coordinator.
Hi, Jesus de Leon Serratos, HMIS Project Manager.
And I'm Craig Blaze Fierro, the Program Assistant.
So, thank you, team. We are filling in for Cameron today. She's on the line, but she's not facilitating the meeting. She's got lots of other items going on for Continuum of Care program planning, and some of you are involved in that as well, so you've probably already talked to her at least once today. So we're going to handle the meeting, and you'll see the agenda that's been on your screen. We've got lots of information for you today on a number of different topics, so we're excited that you've joined us, and as always, feel free to put your questions into the question box or raise your hand virtually by clicking on the little hand, or and then Craig can unmute you if you need to. But we love getting your questions. Also, just want to remind you, if you're on this meeting, obviously you got the invitation and registration link somehow, but if someone had to send it to you and you didn't get it directly from us, or you know other people who would like to be getting the meeting invitation, let us know. You can, first let me go back up. If you're not getting our invitations and you think you should be, make sure that you check your spam folder and also add Cameron at THN to your safe list for emailing. We've heard from a few people that Cameron's emails, including these meeting invitations, have been going into people's spam folders. So it looks like from our end that you're receiving it, but if you're not receiving it, check there first. And if there's still a problem, you can follow up with me, or Craig is showing you on the screen how to sign up for email lists.
You can sign up for 4 different lists at any given time right here. Make sure you spell your email correctly, because it will not go through. If it bounces once, it will unsubscribe you. So make sure you enter everything correctly the first time. To be on this list, you need the Balanced State CoC News right here. That's the one you'll want. If you're already in the system, it should tell you, and if not, it'll tell you completely added. If you do have another issue, you can reach out and email me anytime, and we'll double check and get you added.
And that's Craig, K-R-A-I-G, at thn.org. All right. Next, Craig's going to show the map of where all of you who registered are.
We had 78 as of this morning, so I pulled this a little bit before lunch. We're getting a good representation of across the state. I'd like to see a little bit more Amarillo and El Paso sometime, but we're doing pretty good. We even have one from New York. Benjamin Mahoney's watching us from New York right now. But we do have a great spread. We appreciate it. Every time y'all show up, y'all learn something. We learn something from you. So thank y'all for showing up today.
Yes, and we love seeing the more red dots on the map, the better. All right, so let's jump into our first big topic for the day. It's one of our CoC current priority projects. We're going to be talking about CoC coordination with Emergency Solutions Grant, or ESG program, and other consolidated plan jurisdictions. All right, so we're going to be flipping through a number of different documents here. So hang in there with us.
Just click through it.
Oh. All right, so I first wanted to start with an overarching document called Community Resources for Homeless Services Planning. Many of you are involved in your local homeless coalition, or if you don't have a formalized coalition in your area, you might have a smaller group of people that you work with informally to do homeless services planning or service delivery or evaluation of services or anything like that. We wanted to talk to you about some of the other groups that you could get involved in your local homeless coalition if they're not already involved. So some of the major topics are the education arena, particularly anybody who has a McKinney-Vento Homeless Assistance Grant, the Texas Homeless Education Office, or THEO, and your local homeless education liaisons, which all schools in the country are required to have. So if you didn't know that your schools have a homeless education liaison, now you do, and you can find out who that person is. And I'll show you how to do that in just a moment. For homeless youth, we often refer people to TNOYS, the Texas Network of Youth Services. Housing, you'll see public housing authorities and consolidated plan jurisdictions, those entities that receive several different pools of grant funding from HUD, CDBG, HOME, HOPWA, and ESG. We're also looking at health arena with community mental health centers or local mental health authorities and community health centers and any other kind of hospital or clinic in your community. And finally, other planning bodies like councils of governments or community action agencies or aging and disability resource centers. So now I want to show you another document that spells those out a little bit more and has links. You'll see we've created this for you, and it's in the handouts, Craig tells me, on the webinar. And so with homeless education liaisons, TNOYS, public housing authorities, you'll see I tried to put the most important information that you would need to know as a homeless services provider or as a member of your local homeless coalition if you want to reach out to these other groups and find specifically which ones are operating in your community. And we'll see it's the ones that we just talked about: consolidated plan jurisdictions, some resources we'll review today, local mental health authorities with a search function, health centers with some search functions, council of governments. Anyway, we hope that document will be helpful for you as you're looking at who else could be participating in homeless services in your community but may not already be. All right, next we want to go to a resource page that we have, and this one is specifically about coordinating between CoC and ESG and consolidated plan jurisdictions. All right, so again, we'll make that available to you, and the slides I'm going to go back to right now have a lot of these same links in there, so we'll get to the documents through those links. Okay, so just a little clarification for some of you who might be new or haven't heard this before. Texas Homeless Network, that's us. We're what's called the lead agency for the Texas Balance of State Continuum of Care. That means we help all the members of the Continuum of Care geographic area carry out the responsibilities assigned to us as a Continuum of Care by HUD. As a balance of state, we've got one more layer of sort of administration and planning that some other smaller COCs don't have, because we as THN staff aren't in every one of your communities. We try to work very closely with your local homeless coalition, and those groups do facilitate a lot of the CoC level planning in your local community. And you can find out who your local homeless coalition is. I've got a link in this website, in this presentation to our website that shows all the active local homeless coalitions along with their contact information. If you don't have a coalition yet, there might be one agency in your community that receives Continuum of Care program funding or Emergency Solutions Grant funding, and that would be a great group to take on the leadership of planning and service delivery for homeless services in your community. So that's who's going to be representing the CoC when we're talking about CoC coordination with ESG and ComPlan jurisdiction. There's going to be both Texas Homeless Network and, if it's in your community, your local homeless coalition. All right, so how do you know who gets Emergency Solutions Grant or who is what's called a consolidated plan jurisdiction in your community? Well, you can go to HUD's website and find it in the HUD Grantees section. All right, so you'll see on this page you can view the organization by location. So we could choose Texas. Let's just go through one example. And then it asks you again to find either an organization or a program. And if you want to know, for example, only ESG, you can uncheck everything else. But if you want to know all those programs and who has them in your state or your specific community, again, you just fill in the check boxes that you want, hit update, and it should show you everything you're looking for. So it's a really handy way to find what is currently available and happening in your community in terms of HUD grantees for those specific programs. All right, oops. And then if you want to find, or let me back up. Consolidated plan jurisdictions are usually a city, a county, or a state. Or maybe they're always a city, a county. For sure in Texas, they're always a city, a county, or a state. And they have to do consolidated plans, which is a 5-year plan that is their application to HUD for the funding sources called Community Development Block Grant, or CDBG, Home Funds, which I don't remember what HOME stands for, but they're also for affordable housing, HOPWA, which is Housing Opportunities for Persons with AIDS, and that's for housing for persons with AIDS, obviously, and then ESG, or Emergency Solutions Grant. That's the one maybe most of you are familiar with. It used to be called Emergency Shelter Grant, and that one from HUD pays for street outreach, homelessness prevention, emergency shelter, and rapid rehousing projects. So if you want to see, hey, does my community have its own, for example, annual action plan? So there's the 5-year consolidated plan that the jurisdictions use to apply for the money to HUD. And then every year of that 5-year plan, they have to submit a 1-year annual action plan that says, okay, in this 1 year, we're going to do these things as it relates to our 5-year plan. So again, you'll see Craig is walking you through it on the list. You can select a grantee. The state is the grantee for many of you who do not have an ESG jurisdiction or a ComPlan jurisdiction. Let's see, in Balance of State Continuum of Care, we've got 40 ComPlan jurisdictions, and among those are 7 ESG recipients. The cities and counties that are ESG recipients are City of Brownsville, City of Corpus Christi, City of Laredo, City of Lubbock, Brazoria County, Hidalgo County, and everyone else for ESG falls under the state of Texas, and the recipient for that is the Texas Department of Housing and Community Affairs, or TDHCA. So if we click on Texas here, that is, let's see.
Brownsville, Corpus, Lubbock, Brazoria, Hidalgo.
Laredo. All right, so those are our 7 ESG recipients. And we'll do 2015. So it should pull up the annual action plan for all of those ESG recipients. So you can read exactly what they've written. If you haven't already been involved in the developing of that plan, you can read it here and follow up with your local staff or with TDHCA staff if you fall under the state ESG, and see what they're doing with the ESG funds.
There's no voting items today, are there?
Pardon me?
Bobby has a mess. There's no voting items today, are there?
All right. Also, just wanted to point out, these are, again, the 7 ESG recipients, but we do have 33 other consolidated plan jurisdictions within our balance of state. So you are likely covered by one of those. I'm not going to go through those, but you can scroll through these search functions and see for yourself which ones are in your community or near your community. All right. Now, this was the...
Was some of it too?
Yeah. All right, sorry, there's a lot of moving parts here today. The next thing I wanted to show you all is an official guide and video that HUD just released in April that talks all about how CoCs, or in our cases also the local homeless coalitions, can be coordinating with their consolidated plan jurisdictions, which include ESG recipients. So Craig, let's go to the video. I just want to play the first few minutes of it because I think it does a good job of describing. Whoops.
Sorry.
Can they hear?
In order to meet the intent of the HUD Act and opening doors rules, jurisdictions receiving HUD CTE formula funding and continuums of care
Okay, they can't hear it.
must pull out planning and a number of other activities to ensure strategic targeting of scarce resources. While such coordination and collaboration are not new
They
concepts,
can't hear it?
No.
Okay. All right.
Videos and videos.
Sorry about that. Craig is just telling me that you can't hear a video that we're trying to play for you. We can hear it, but if you can't hear it, you will have to watch that on your own. It's 6 minutes long, but about the first 3 minutes, I think, do a really great job of describing what HUD means by CoCs coordinating with consolidated plan jurisdictions. So I would encourage you to read that, watch that video. But let's go back to this link because I want to show you the guide. So there's a video, a short video, and then there's a more extensive guide. And if you're familiar with HUD documents, you'll see this looks like the same format as they've put out for a number of other guides. I just kind of want to scroll through and show you some highlights. Here?
Yeah.
You'll see an introduction, collaboration between CoCs and ESG recipients. And then in each section, it talks about what are the CoC specific requirements from the CoC interim rule. That's HUD's regulation for the Continuum of Care program. And then ESG specific requirements from the ESG interim rule, which are HUD's regulations for ESG. So I think that makes it very clear. And then the guide goes on to explain how to bring those two together. Here's a section on collaboration on written standards, again, CoC specific requirements, collaboration on planning and reporting. Anyway, it continues that way throughout the document. And then gets into CoC coordination with consolidated planning and very specific sections of the consolidated plan that are about homelessness and that your consolidated plan jurisdictions can be reaching out to you to help fill in and write. So y'all could do it together. And then finally in the end, it talks about different ways that CoCs and con-plan jurisdictions can coordinate and collaborate. Everything from having joint meetings and the pros and cons of that, having work groups, developing joint plans and policies, and collaborating on funding decisions, which we know are always critical. And then the last section is some potential challenges to coordinating and collaborating and how you might be able to work through those. So I think it's a really thorough document. Now we're going to head back to the slide presentation. Yeah, and this goes a little bit more in depth of some specific things I wanted to highlight from the guide. You'll see this is kind of an outline of what is included. In the collaboration section between CoCs and ESG recipients specifically, it talks about coordinated assessment, or what we now call coordinated entry, written standards for providing assistance, and that's both CoC written standards and ESG written standards. And we'll be hearing a little bit more about that in a few minutes. And the third topic is planning and reporting for ESG. Then for collaboration between CoCs and con-plan jurisdictions, so that includes ESG recipients, but it also includes any jurisdiction that gets CDBG, home, and or HOPWA, even if they don't receive ESG. And the requirements there are related to the consolidated plan itself and to the CAPER. The CAPER is the Consolidated Annual Performance and Evaluation Report, and that's the end-of-year report where all these consolidated plan jurisdictions tell HUD, okay, this is what we accomplished this year. So again, there's the 5-year consolidated plan by which the consolidated plan jurisdiction applies to HUD for funding. And then within that 5-year plan, the jurisdiction must submit annual or 1-year action plans. And at the end of every year, they submit the CAPER to say this is what we did this year. And then, as I pointed out, the last section in the guide is strategies for effective collaboration. So I think it's a really thorough, helpful document, and I will be working with all of our ESG recipients and then eventually our other con-plan jurisdictions on fleshing this out for how we'll do this in the balance of state. There's a handy-dandy chart in there that I pulled out for ESG recipients and CoCs. You'll see that in the middle set of boxes there, some specific items within the action plan that we're going to be collaborating or consulting on are the allocation of ESG funding, or how the con-plan jurisdiction is planning to use their ESG funds. We want to make sure that we're coordinating with your local homeless coalition and with us as the CoC on that. Developing ESG written standards, performance standards for ESG funded projects, looking at, okay, what kind of minimum standards do we want to set to make sure our ESG programs are being effective, evaluating ESG outcomes, similar kind of thing. And then, of course, using HMIS, which all of the ESG projects are required to do. Then from the CoC side, we want to make sure we're consulting with ESG recipients on CoC written standards and on establishing the and using the coordinated entry system. So I thought that was a really nice brief way of explaining the major points of collaboration that we're all required to do. Now I'm going to turn it over to Sophia, and she's going to talk about the status of coordinated entry, because that is one of our required areas for collaboration, and she'll talk about where we are at the moment.
So for those of you that are not aware about what coordinated entry is, it is an important process through which people experiencing or at risk of homelessness can access the crisis response system in a streamlined way, have their strengths and needs quickly assessed, and be quickly connected to appropriate tailored housing and mainstream services within the community should it exist. And if it does not exist, or the client is not eligible for it, you're gathering important need data for your community to do planning with. So where we are in the balance of state, it's been slow, and that is not, I've been talking with other people in charge of implementing coordinated entry in other balance of states, and they're experiencing the same issues due to their large geographies, so we're not an anomaly. And what we have found over the course of the last 2 years is really the biggest issues have been that the scope of systems change that needs to happen in communities, I don't think we grasped it when we went out the first time. And so we're finding that systems do need to overhaul what they're doing in order to fall in line and implement a coordinated entry system. And then also on top of that, because we are such a large geography, because we have CoC and ESG funds throughout the state or throughout our jurisdiction, we need to develop separate community implementations. So that's due in part to the funding, but it's also due in part to the fact that every community will have different strengths and challenges, and so we need to tailor the system according to that. So where we are is we have been working with 7 pilot communities over the course of the last 2 years. They are listed on the slide. And in these pilot communities, we're really working on refining the coordinated entry implementations from last year. We did some data analysis earlier this year to find that a lot of entry points aren't doing the assessment. So it's not being done. And what we're doing now is we have, as an agency, overhauled, or Victoria has overhauled our coordinated entry workflow in HMIS that's much more streamlined, I believe, and it incorporates the VI SPDAT. And we're also doing a series of webinars, as we listed here, that are available to both, obviously, pilot communities and communities that are not pilot communities. So we're doing a lot of education, I think a lot of really robust education that we hadn't done before. We looked at the data to make decisions about how things needed to change. And we are also, well, I am also meeting virtually with the coordinated entry transition teams in these pilot communities to discuss how we are going to change what had been implemented previously. So it's a really interesting process. It's all about continuous improvement. It is not a failure. It is not a bust. It's just, this is just how it is. And I think what we've really found is that because we are not in the communities, or there's not a local full-time presence really working on system change and coordinated entry, that has also caused a lot of difficulties in the implementation of coordinated entry. So next slide. So I just wanted to let you guys know there's different, I guess, permutations of communities that we're working with in regards to coordinated entry. So again, with pilot communities, we're working on refining the current systems that exist, or starting again, really. In communities that receive CoC program funding, we started the first step in a series of steps to get coordinated entry implemented in those communities, and this first step is to get them to use the VI SPDAT and the FVI SPDAT, which the VI SPDAT stands for Vulnerability Index Service Prioritization Decision Assistance Tool, why we call it the VI SPDAT. Yeah, and so they're using this tool to prioritize clients for their resources. And then with communities with ESG funding, we'll be working to do the same thing with them. And then in other communities, and for everybody really, but in particular for other communities, materials will be slowly released over the course of the next several months to help facilitate coordinated entry implementation. So the CoC program, the communities that receive CoC program funding and ESG funding in our pilot communities are getting our attention sooner because they're statutorily mandated to do this. So that's why they're getting our attention. And I do want to say it's not that we don't want to help other communities, it's just they're our priority because they receive this funding, and to continue receiving it, they need this. So I'm always open for questions from everybody. Next slide.
Has HUD released a full date on balance safety?
No. So HUD, great question. So Craig just asked if HUD has released essentially a deadline for when CE needs to be implemented. No, they have not. However, we have heard rumors that, and we've heard rumors for a while now, but we've heard rumors that more guidance is going to be coming out. The last guidance that came out was the coordinated entry policy brief that I think came out in 2014, 2015. So that's the last like really substantial guidance that we've gotten apart from the CoC interim rule and the ESG interim rules. So they keep saying they're going to release stuff. We don't know whether or not it'll have a deadline, but that, I think regardless, we need to implement this post haste. Is that right?
Yes.
Exactly. you know, we just have to do it. Next slide. Oh, it's okay. So the thing that I really wanted to highlight, which is why it's getting its own slide, is that all communities really, they need to consult with us. The coordinated entry system needs to be standardized across the entire balance of state, so that includes communities that receive CoC and or ESG funding and other communities. So even, let's say for example, Paris, Texas, because I know you guys are working on this, so not to pick on you guys, but I know you're working on this, your system needs to fall in line with ours. And this makes sense for a variety of reasons. One, it's the mandate, but two, if you ever receive CoC and ESG funding in the future, you would have to overhaul your entire system to be in line with our standards, and frankly, you're going to go through a lot of work that you didn't need to do if you followed our metrics and standards. So yes, every community needs to consult with us about coordinated entry. And then in addition, we're really, like Mary mentioned, we're really trying to focus more on the LHCs. THN, we have very limited capacity. We are not in your communities, and we treat the LHCs as an extension of us. And so together with your local homeless coalitions or with your LHCs, we're going to be leading this effort. So please keep that in mind. Any questions or anything?
Can you send out the coordinated access policy so they can adopt it?
What? Oh, so just so you guys know, we are working on written standards and materials. They have not been released yet. It's very much for CE. It's very much all hands on deck all the time at THN, and there are even people in the pilot communities that I've been promising stuff to for a long time. So they're coming. I've set an internal deadline for myself, and it's coming. I know, Craig just smirked. It's coming. I would recommend that you guys, if you want to start meeting about this, you at least meet to educate yourself about the basics of coordinated entry, and I can send out materials on that. So what is coordinated entry? What are the standards? What does HUD want? And then talk about how you think that would look in your community. And so you guys know, you're going to be deciding what entry points you're using, and what kind of model you're using, but the balance of state, we have the common assessment tool developed, and we're using HMIS for this process unless you are an entity that is statutorily mandated not to use HMIS. So your local victim service providers, you'll need to find a workaround for them.
Just trying to bring videos.
It's okay. Oh yeah, and great. Good point. So if you go to our YouTube page, you'll be able to find the series of webinars that I did earlier this month, so like late May, early this month. And they're broken up into the 3 A's. There is a 4th A, but I forgot to press record. And the way HUD breaks down coordinated entry into manageable bites is this idea of access, assess, and assign. And so I did 3, and we in the balance of state have accountability, because accountability or continuous improvement is a really big piece of this process. So that one's about general system change. That's like CE 101, coordinated entry CE 101. If you go up, Craig, more. So right there, so you'll see coordinated entry access, coordinated entry assess, and then above it, coordinated entry assignment. So that is basic information about what that piece means, but I also go into detail about what THN is doing and what our standards are. So while it may not be on paper right now, it is on webinar. So if you're curious about it, I highly encourage you guys to look into this. And yeah, that's about it. There's a lot of really great resources out there. I'm more than happy to share them with everybody. Any other questions?
Any materials you can send would be great.
Okay, so we'll include that in the agenda notes. Yes, ma'am. Oh, and my email address, Craig, I think is going to type it in right now, but it is Sophia, SOPHIA, @THN.org. And again, always happy to field questions.
Great. Thank you, Sophia.
Okay,
We're on slide 17. All right, so back to the PowerPoint. The next thing that we're going to talk about is one of the other requirements is for CoCs and con-plan jurisdictions to collaborate on written standards. So I wanted you all to know that we on our team have drafted written standards for rapid rehousing projects and for permanent supportive housing projects. And as Sophia said, we are just finalizing the drafting of ones for coordinated entry. We hope to have all of those written standards available for public comment maybe next month. We're not really sure, but that's our general time frame. We specifically want to hear from our ESG recipients or ESG sub-recipients that get money from a recipient and any other con-plan jurisdictions on those written standards, because that will be one of the ways that we consult with you on the development of the CoC written standards. Of course, everyone is welcome to give public comment, and we will be sending out information about that via our BoS CoC news email list that Craig showed you how to sign up for earlier. So just wanted you to know that's where we are. And now ESG doesn't pay for permanent supportive housing, but it does allow to be paid for rapid rehousing and coordinated entry. So those two sets of written standards we'd love your input on. Another set of items that we need to collaborate on is ESG planning and reports, and I showed you those earlier. Allocation of ESG program funds. In my role, I'm responsible for reaching out to ESG recipients on this, and many of you, if you're on the call, you know we've been talking a lot over the past few weeks, either about con plans or who are your subrecipients, but we've also talked a little bit about how are you allocating your ESG funding. So for example, if in a community you have one project that's funded by CoC program that provides rapid rehousing, but not really any other homeless assistance funding, you might want to use your ESG money for street outreach and emergency shelter. However, if you have a lot of emergency shelter funding already in your community, you might want to target your ESG funding more to, say, rapid rehousing or homelessness prevention. That's what it means there by allocating program funds. And to make sure all of that makes sense within your other funding sources within your community and within the balance of state. ESG program evaluation in the CAPER. So far, our HMIS team has worked with subrecipients to get the CAPER data to the recipients. We're going to be doing a little bit more over the next year with analyzing that data. And the next one too, setting performance standards. So really looking at how we're, as a CoC and your local homeless coalitions, more connected with how the ESG projects are performing. And finally, participation in HMIS. ESG subrecipients have to use HMIS or a comparable database, and this CoC and ESG recipients and subrecipients have been doing that for several years now. And here's a handy dandy chart that is similar to the early one, but this one is specific to CoCs and con-plan jurisdictions. Some of those specific sections in the consolidated plan you'll see are listed there. Homeless needs assessment, well, the CoC can help with that part by providing PIT and HMIS data. PIT is point in time count. So here's another instance where your point in time count in your community, if you do one and we have the data and you have the data, you can work with your consolidated plan jurisdiction to make sure that data is in the homeless needs assessment. For the inventory of homeless services and facilities in the con plan, the CoC can help by providing housing inventory data, or HIC. Many of you participate in that with us. In the homeless strategy and homeless activity sections, consulting with the CoC, which would typically be us in our office, but we would love it if some local homeless coalition folks were involved in that as well. For the CAPER, the CoC can help by providing relevant data. Obviously, we talked about that. And then going the other direction, CoCs, and specifically projects within the CoC, need the consolidated plan jurisdiction to fill out what's called the certification of consistency, meaning that whatever project is applying for continuum of care program funding, they need to have that certification completed by their local consolidated plan jurisdiction. And that's an indication to HUD that the consolidated plan jurisdiction is aware that this group is applying for CoC program funding and that there might be a funded project in their community in the future. So where are we on all of these? Same kind of thing. We currently, I wanted to put check marks in here, but they looked a little funky, so I took them out and left bullet points. But we're doing all of this. CoC is providing PIT, HIC, and HMIS data to the con-plan jurisdictions. The CoCs and the jurisdictions are consulting on annual action plans. We've just done a few of those recently with Laredo, Beaumont, and Brazoria County. The CoC assists HMIS users and comparable database users to provide data for CAPERS. And again, project applicants for CoC program funding are in fact obtaining certifications of consistency. So yay, all of us, we're getting all of that done. On data and performance, just a reminder that all projects are required that receive CoC program funding and ESG program funding are required to use HMIS. However, victim services providers cannot use HMIS, but they must use a comparable database. I've been talking with a lot of you ESG recipients about this recently too. And just a shout out to our HMIS team who's recently been delivering eCart webinars and helping our victim services providers with the eCart reporting. And there's a link to eCart on the HUD Exchange, because that is the way the CAPER reports are now being delivered to HUD, is through the electronic system called eCart. eCart is electronic CAPER annual reporting tool. Thank you for the question, and thank you for bringing that right up. Yeah, so it's an electronic way that your ESG recipient gets their CAPER data to HUD now. It used to be in paper format, now it's electronic through the eCart tool. And Craig is pointing out there the tool itself and the guidebook. So, short answer, if you have any questions about HMIS and CAPER, contact our HMIS team at hmis@thn.org. As always, we want to remind you of the HUD regulations guiding the CoC program and the ESG program. There are links there. And if you have any questions on any of this material, you are welcome to contact me. I'm, again, Mary Ricklick by the CoC manager, mary@thn.org. Okay, that was a very long section. If you have any questions now, certainly type them in.
Do you want to show the resources on the website?
No, we're...
Okay.
Yeah, so that's it for this section on CoC and ESG coordination. Whew. I'm going to turn it over next to Lindsay for our next agenda item, which is the Balance of State Continuum of Care Point in Time Count Report.
Hi everyone. We will have the Balance of State point in time full report out to you within a couple of weeks. Thank you for being patient with us while we get that together and on top of everything else that has been going on. But I can tell you that our numbers have continued to decrease, so that is fantastic. The number of people counted this year, just a tad over 6,000. Way to go. Next, I will just briefly, I'll briefly go over our system-wide performance measures that will soon be implemented, and Craig's going to pull that up really quick because it might seem like a lot of information. It's going to look like a lot of text on your screen, but I promise you, you have help. That's what we're here for. It's going to be great. and it's more than a mandate. It will help reduce and end homelessness. So this is going to be really fantastic. System performance measures. Our community COC is now required to measure our performance as a coordinated system in addition to analyzing specific projects and project types. So the selection criteria for HUD to use in awarding COC funding requires COCs to report system level performance to HUD. It's intended to encourage COCs in coordination with ESG recipients and all other homeless assistance stakeholders in the community to, on a regular basis, measure their progress in meeting the needs of people experiencing homelessness within their communities. So there are a total of 7 performance measures. I'm going to show you 6 because one of the performance measures does not apply to us at the moment. So we're only going to do 6. There's really no reason to look at anything extra. So our first one is going to be length of time homeless. And there we go. The goal here, and my mouse is not working. There we go.
Are you left-handed? I got you. I got you.
You got it?
I got you.
Okay. Oh, it's like a Monty Python skit. So our goal for length of time homeless is kind of obvious. It is to reduce the length of time people are experiencing homelessness. So we will be looking at the average and median lengths of time people spend in homeless situations. In that we mean emergency shelter to transitional housing. So number 2, returns to homelessness. Our goal is to have clients exit the system and not return. So we'll be looking at the percentage of people who move to permanent housing and who then become homeless again within the next 6, 12, and 24-month time period. But again, the goal is to have those clients exit the system and not show up in those reports. The third measure is the number of people, the number of homeless people. So the goal here is to reduce the number of people who are homeless. We're going to compare PIT numbers to the annual count, and that we're going to be able to see how people move through the system, how to budget for the number of people, because if you're finding that you have more people than what you're currently budgeted for, then that needs to be adjusted, or less people than what you think you have in your budget, and we're going to look at gaps in the services there. The fourth measure, employment and income growth, and this is for COC funded projects. Our goal here is to increase the percent of people who gain or increase employment or non-employment cash income. And what we will be doing is comparing the income at entry to the income on the annual assessments or the income at exit.
It's non-employment cash income with benefits?
Yes,
Okay.
yes, but cash benefits. Okay, the fifth one, number of people homeless for the first time. We need to reduce that. That's the goal.
Here.
There is a theme of reducing and ending, preventing. The number of people that so this one's a little weird, and obviously we're going to be taking care of this, but just to let you know, if a person enters into your housing system, then what we'll do is take a look 2 years prior to that entry, and if the person has not been served within the housing, then they won't show up. So this will be their first time homeless. Obviously, we want to stop people from entering the system, period. So this is where our street outreach comes in. And so we can go to number 6, successful placement from street outreach. The goal here is to increase the percentage of people who exit to emergency shelter safe haven, transitional, permanent housing, and we'll look at the people we exited who exited street outreach for housing placements. So the main goal here is to get people permanently housed and then to make sure they really don't even enter the system, period. And that's what we want, and that's where, as Sophia just whispered, diversion comes in. So these are your system performance measures. They will be entering these into our HUD HDX within weeks. And it's going to be great. We are also going to be, I want to say performing because we talked about outfits and costumes, but there will be a nice presentation at the THN annual conference in September on system performance measures, and I highly suggest everyone attend because this is a really, really fantastic way to make data-driven decisions, which is everything that we have to do from now on.
Make data greater.
Okay. Data's always been great.
I know.
Okay, I'm done. Thank you.
Thank you, Lindsay. I think Jesus has more to follow on.
Yeah, and it's just adding to this, because you guys are going to be receiving some emails from us. As you notice, in order for these measures to be successful, we need your help. If you have, specifically if you have emergency shelters, housing projects, because you have to go and look at your data. You have to go and look at your clients that you currently have enrolled, and you have to see whether those clients are assessed. If you, for instance, enter a client in 2012 and you haven't done any assessments, that's not going to help. So you need to go back, check your clients, and make sure they have an update assessment if they are still enrolled. An update assessment for 2013, 2014, 15, and so on. That's what HUD asks. They ask to have an assessment at entry and assessment at exit. And if the client is facing your project for more than a year, then you have to do one annually. That's what helps us have better data, and that's what helps you get better APRs as well, because data is not pooled if the client doesn't have a current assessment. So we need your help in this. You're going to be receiving a lot of emails from us as we go and notice these things, but we're asking you guys to be a little proactive as well. If you have some time, go and run an APR for your projects and check your clients. If the number, what you can do is run a couple of reports. You can run a clients in programs report and run an APR for the same period of time. If your numbers don't match, that means that, yes, the clients are enrolled, but they don't have an assessment, and you can go and do an update assessment so they can show up in your APR. Again, we're going to be reaching out for a lot of our projects, but you can help if you do this also on your own. If you need assistance, if you have questions on how to do this, email us, and we'll more than gladly help you out. But just pay attention because you will be receiving some emails. We're changing stuff around. We're making sure that the projects that you have match with what you enter in the competition. If the name, because we are changing a little of the name conventions as well to reflect the actual titles or names of projects that you have in the competition. So if you see a change in there in your programs, that's what it is. It's the same program. Still, if you have an emergency shelter, it's still an emergency shelter. You might have just changed to reflect that name that you use when you enter the competition. So again, if you have any questions about this, email me, email HMIS team, and we will be more than glad to help you out. Thank you.
Okay. Thanks, Jesus and Lindsay. So you'll see we are on our team too getting more data driven and trying to make sure we're giving you what you need to become more data driven. All right, the next items on the agenda are about the HUD Continuum of Care program. And we want to show you, you should have received an email from us yesterday, I believe these went out. And they are also here on our website, so we're going to look at them from our website. If you are a renewal project, which we've got about 20 of those, there is a checklist for you that says how you can start preparing for the competition right now, even though HUD has not released the Notice of Funding Availability or NOFA. There are some things that you can be doing to start getting ready. I want to be at the top. Okay, here we go. So this one is labeled at the top, preparation for renewal projects. I'm going to run through this one because, hold on, the mouse got away from, I want to read this first part because I think it's really important. No matter how many times you apply for renewal funding from HUD's Continuum of Care program, the process can be daunting, and you know it's complex. The best way to manage this complex process is to start work early. So just a reminder, this document is just a checklist to assist you in preparing, but details for completing the entire process will be released once HUD releases a Notice of Funding Availability or NOFA. Once HUD does that, we at THN will create and release what we are calling the CoC Program Competition Request for Proposals, or RFP. And that means that is going to tell you how our CoC level competition will be held, that's in conjunction with and required for HUD's competition. So some of the things that you can start doing now are looking at your program design, everything from how you describe it to what are your eligibility criteria, are you using a housing first model, and for those of you who had an individual review call with our THN staff, look at what we talked about there and some of the areas that were your strengths and your areas that you could grow in to help improve your score and make a better application and a better project. Registrations, just make sure you're up to date on your DUNS number and your SAM registration. Begin work on your project budget, to collect match and leverage documentation, but don't date anything yet because HUD is usually very specific about the date range that they want on the match and leverage letters, but you can certainly start identifying your match and leverage, and especially if you need to find additional match or leverage resources, now would be a great time to start. We want to point out for all CoC program activities besides leasing, HUD requires a 25% match. Also, the CoC application that THN writes on behalf of the entire CoC gets a score from HUD as well. And that, in large part, determines how much money our entire CoC receives and the projects within it. We get points if there's at least 150% leverage. So we are going to require every project application to meet that minimum 150% leverage in the application this year. So I wanted to point that out. Update your project description. Pull an APR from Client Track or your comparable database to make sure your data is all in order. There's a link to a video from our HMIS team on how to pull your APR. Collaborate with your con-plan jurisdiction to ensure that you're aligning on goals and in preparation to get the certification of consistency. Then some things that you must do as part of your updated profile in eSnaps, which is another HUD electronic format where the CoC program applications are entered. Complete your SFLLL lobbying activity form, your Jug-Free Workplace certification form, your organization's code of conduct, gather that, the SF 424 supplement survey, which is only for nonprofit organizations. Prepare your locks spreadsheet and send that to us. Ben at thn.org is collecting those. Submit results of your HUD monitoring. And then stay informed by reviewing the CoC interim rule, making sure you're on the HUD Exchange email list, contacting me. You'll see there, I didn't announce it earlier, but I have changed my last name. I had been Mary Dodson. I'm now Mary Ricklick. Or again, some of you knew me before when I was Mary Ricklick. I'm now back to Mary Ricklick.
You've always been Mary.
I've always been Mary Ricklick, but just veered off, included Dodson for a while there. There are 2 HUD training modules on the CoC program that we want to make sure you have links to. These are pretty new as well. HUD recently released these, and we think they're a really great way to either remind you or help you learn what it would mean to get this particular grant funding from HUD. And a list of additional resources, all kinds of things we thought might be helpful for you. And on the last page, we have included the exact chart that HUD has in the last year's application for CoC program funding that asks about housing first. So we want to make sure that everybody is able to answer those questions in time for the application.
I do have one question about this.
Okay, Craig says we have a question.
So each application has to show the ability to match at 150%, or just for clarification, is that not a cumulative amount, or is it for each applicant?
It is a requirement as a cumulative amount, but the way that we get to that cumulative amount is that we require every project to minimally meet that. We don't want to rely on only a few projects to go above and beyond 150%, so that brings the total or aggregate leverage up to 150%. So we are, in fact, requiring every project application to meet at least 150% leverage. Good question. All right, so that was the renewal project checklist. Now we're going to go to the new project checklist on our website.
Yeah, you'll sit on that one.
Okay, so new projects. You've got some similar requirements here, but there are a few different things because you will not have applied for HUD Continuing Care Program funding in the past, or if you have recently lost your funding, but you're applying for as a new project, or if you are reallocating from a transitional housing project to a new rapid rehousing or permanent supportive housing project, this is for you. Oh, and just a reminder from Cameron, she entered a question here. The locks collection is already in process and was due yesterday. So if we didn't receive it yesterday, you missed your deadline and are now out of compliance. So that's a very important note. All right, for new projects, similar things here. You'll see, make sure your program design is solid. And there's some specifics here about new permanent supportive housing projects. The only kind that are being considered by HUD are ones that serve 100% chronically homeless families or individuals, which includes youth. All projects must adhere to this is ours requirement, all projects must adhere to the Housing First model and must be low barrier. So let me repeat this. If you're applying for a new permanent supportive housing project, you've got to meet all these requirements, either serving all chronically homeless families or chronically homeless individuals, which includes youth. You must be using a Housing First model, and you must be low barrier.
And that goes for existing projects as well, which we covered in project review. Mm-hmm. And just a quick note for reallocations as new projects, we may be asking you all for a little bit more, but use this new project checklist for now. We're still determining what old data or current program data we're going to be using for you all in the competition.
All right, this was Cameron, thank you. All right, for new rapid rehousing projects, again, if you're brand new or you're reallocating from transitional housing to rapid rehousing, or you had a project in the past that didn't get funded and you want to try for a new rapid rehousing, The HUD populations you can serve are homeless individuals and families, including youth, coming directly from the streets or emergency shelters, or fleeing domestic violence situations, or in some other way meeting paragraph 4 of HUD's homeless definition. We are also adding the criteria as a CoC that all projects must be low barrier and follow the Housing First model. So you'll see we are making our priority criteria, or our only criteria, based on what HUD funded in the last competition, because we do not want to risk any more of our projects losing any funding. HUD is also allowing new supportive services only projects, specifically for centralized or coordinated entry systems. So we would also accept an application for that kind of project. Again, we want to make sure your project design aligns with the permanent supportive housing or rapid rehousing model. And we're going to get to this later in the checklist. And like with renewal projects, look at your program's intake paperwork, eligibility criteria, termination forms, and policies and procedures to make sure they are all in line with low barrier or Housing First. And if you are a reallocated project, review your THN project review tool, score sheet, and assignments, or make adjustments as we talked with you about. If your agency doesn't already have an eSNAPS account, you'll want to set that up. Again, that is the way that you will submit your application to HUD. And we have to have yours in there in order for us to submit it as the joint application for the entire CoC. Make sure you have a DUNS number. Make sure you are registered in the System for Award Management, or SAM. You can begin working on your project budget, collecting your match and leverage documentation, collaborating with your consolidated plan jurisdiction, and completing the forms in the applicant profile that I went through earlier, lobbying, drug-free workplace, and SF 424 supplement, as well as collecting your organization's code of conduct. Stay informed, and resources are the same. Housing First chart that we saw from the application in 2015. We don't know if HUD will have that same chart in the 2016 application, but if not, it will probably be that same content. So that is what you can be doing to be getting ready if you're considering applying as a new project. We don't know when the NOFA will be released. We saw on HUD.gov that it could be, their estimated release date is June 30th. So we are kind of planning for that. We also saw an estimated due date of September 30th, which means that, at least from that website, they're looking like they're going to give us 90 days, which would be fantastic. Last year we only had 60 and it was really tight. So 90 would help us have a little bit more wiggle room to work with you all on your project applications and on our overall CoC application to make sure it's as strong as it can be before we submit it to HUD.
Cameron wants to remind us, projects won't have 90 days, we will. THN will have 90 days, the projects won't.
Yes, projects you will not have 90 days because we have to complete our entire process within 90 days. So like in years past, again, HUD will release the NOFA, then THN will release the request for proposals, or RFP, and that tells everybody who's applying in our CoC what the process is, and that will include a timeline. And so your project applications will be due to THN much earlier than 90 days because we have to have our review team score them and rank them, and the board approve all of that.
What happened last year when a project submitted their application?
What happened last year when a project submitted their application late? That was bad news. They were not included in the overall application to HUD.
It was by like, what, a day?
So the board does not want to be in a position, our CoC board does not obviously want to be in a position of having to make any kind of decision about a late application. So please, please make sure you read our RFP very closely so that you know exactly what your due date is, and you must get your application into us by that due date and time.
Doesn't an early submission give us bonus points?
And last year for our overall CoC application, when we submitted to HUD, we did get 3 bonus points from HUD for submitting a day early. So, but that doesn't have anything to do with your due date. Your date, I mean, you're welcome to submit it a day early, but at least by the deadline, or we are going to have to take it to the board for their decision on what to do. And they've already told us, please don't do that. So we're all going to work together to make sure your applications are in by the due date and time to THN. Okay, back to the website. Karen wanted us to show a couple more documents that were in fact sent in an email yesterday, but they are also posted on our website. We want to point them out to you. Housing First resource list. This is our top selections of what you can review if you want to know about Housing First. So the first big category of items we have is just generally Housing First. From a lot of our partners that you hear us talking about all the time, National Alliance to End Homelessness, or NAEH, the U.S. Interagency Council on Homelessness, or USICH, and all kinds of other places.
This is Sophia. I put this together last week. I highly recommend that you guys check out the YouTube series. It is so well done, and it just so happens that the cursor is right on it. But I highly recommend it. I think it's the best way that Housing First has been described in like an entertaining way. So I highly encourage you guys to check it out.
Thank you. And yes, thank you, Sophia, for putting this together. We know you get lots of information, we get lots of information, and we want to be able to direct you to some of the resources we think are most helpful, and this is how we're doing it for Housing First. You'll see there are 3 here specifically on implementing Housing First. So really, not only what is it, but how do you put it into action in your project and in your community. Housing First and Rapid Rehousing, a couple of resources there. Housing First in permanent supportive housing, and finally evaluating Housing First. So how do you know if you're really carrying out Housing First in the way that it's meant to be and in the way that it's supposed to be effective? And effectiveness of Housing First. So some background on, does this Housing First thing really work? Well, these resources say yes, it does. So we are definitely going that way in our CoC. HUD is going that way, and we want you to learn more about it and see how you might implement it in your community. Even if you're not applying for continuum of care program funding, we want you to consider using this approach in your entire community. All right, and the fourth one, oh wait, that's what I just went to. Hold on. This worksheet is all about resources if your project is converting or reallocating from transitional housing. These are some tools that can help you do that. Reallocation guides, looking at the NOFA, CoC program toolkit, resources for retooling transitional housing. That's a big phrase that National Alliance to End Homelessness has been using over the past few years. Some more Housing First resources on this page. Core components of rapid rehousing if you're considering transitioning or converting to rapid rehousing. Here are some resources specifically for rapid rehousing for youth. And then a permanent supportive housing resource if you're considering converting from transitional housing to permanent supportive housing. So, want to make sure you have that resource list available to you.
And those are all on our website under Balance of State CoC, CoC resources, Texas Balance of State CoC grant materials. So when you get lost, that's where you're heading.
All right, great. We are to, yes, we're doing our last topic now of the day. Back to the very first document I showed you, that community resources for homeless services planning, where it listed education, healthcare, housing, other planning bodies. We're now going to look at that second big group of housing planning bodies, because we had con-plan jurisdictions earlier in the meeting. Now we're going to be looking at public housing authorities, or PHAs. Again, this looks familiar to you, I'm sure, another resource list. I'm only going to show you one, and then we'll just kind of name the others. This one I thought was really helpful, number 7. I put it at the bottom, though, because it's very basic. And I know not everyone is starting here, but I do want to show it for those of you who are new. It's called CoC 101, a guide for public housing authorities. So it's a quick way that you can try to help your public housing authority understand what the heck is a CoC, in which we get that question all the time. I know it's very confusing, and I think they do a great job of trying to explain it. Okay. All right, so this slide presentation reviews the purpose of a continuum of care, the elements of a continuum of care, and some ways that the CoC and a PHA can partner. So, as many of you know, a continuum of care can mean a few things. The first one of which they talk about is the people. So a continuum of care means the group organized to carry out the responsibilities required under the CoC interim rule. And it's composed of representatives of various organizations. And you'll see we talked a little bit about that earlier, and some of those are already operating in your community to address homelessness. There is also the CoC program interim rule, which we talked about, and that guides HUD CoC program. HUD CoC program, as listed in the middle box, provides funding for permanent housing, which is both permanent supportive housing and rapid rehousing. Supportive services only, although not anymore, except for coordinated entry. Transitional housing, although as we know, HUD isn't looking to fund that anymore. HMIS, and if you're a high-performing community, homelessness prevention. The CoC on the right is, again, that planning body for a defined geographic area that establishes and operates a system to prevent and end homelessness. The CoC also applies for CoC program funding.
Hold on, can I show Melissa something real fast? Melissa, we're going to go back to thn.org, Balance of States CoC, the third one, the CoC resources, and it's the third one right here, just in case you get lost.
All right. The annual application to HUD, which we just talked about. We want to make sure we're developing proactive solutions, coordinating resources. There's the CoC planning cycle, where we do the annual planning process, collect data and inventory. That's through the PIT count and the housing inventory, and our HMIS data, identifying and prioritizing gaps, developing short and long-term strategies, and implementing them. And this happens not only on the CoC level, but it could be, and hopefully is, happening on your community level through your local homeless coalitions. And it's also all about continuous improvement. So we want to be getting better and better at all of this and having your data inform what decisions are being made. A little bit about HUD's homeless definition, which you know can be a little tricky, and so if you're trying to get your PHA on board, it's good to have that information in there. This is kind of the old continuum of care model that we used to go by. Now we've got a new model through coordinated assessment, or now HUD calls it coordinated entry, where people experiencing homelessness or at risk of homelessness go through a coordinated entry process, and they get assessed and assigned to the housing intervention that's going to most effectively end their homelessness. Diversion is not on this chart, but we want to put a shout out for diversion, where you help people not enter the homeless service system at all, if possible. Sometimes also called homelessness prevention, which I know a lot of you are using your ESG funding for, and in some communities, your community action agencies are also doing some homelessness prevention, specifically with rental and utilities assistance. So here it goes through some of those steps of outreach and intake and assessment, emergency services, supportive services, transitional housing, permanent housing, rapid rehousing, permanent supportive housing. All right, now how can we partner? All PHA efforts to end homelessness are enhanced when implemented in partnership with other organizations. PHA resources are precious. We want to use them to leverage other resources. Each of these ideas is being implemented somewhere in the country, so they are possible to do and to replicate. So what is one way we could partner? Well, establishing a homeless preference in your public housing authority housing. That reduces the time that people are homeless. It increases how much of your public housing authority housing is being used. And of course, it increases housing stability for people who are getting into the housing.
And we can include this. In the resources, but I believe early this year or late last year, HUD released a resource called Opening Doors Through Multifamily Housing, and it's a toolkit. Is it? Okay.
We'll get to it in just a minute. That's okay. That's a good one. There's a lot of good resources. So, establishing a homeless preference within your PHA. That's one way to partner. Implementing a move-up strategy. And that is identifying persons or families in permanent supportive housing that meet the criteria, but they no longer need the supportive services. Wait, I'm getting a little confused on this slide. I think it's somebody who needs permanent housing still, but they don't still need the services in PSH. They can move up to permanent housing that doesn't have the supportive services with it. And so that opens up a new slot for someone who does need both the housing and the supportive services. Third, we want to see people being screened in. So unfortunately, in some cases, many people, homeless people, are screened out of public housing because of past behaviors. So we could see the housing authorities look for ways that they can screen more people in. For example, adopt screening criteria that mirrors the federal requirements for the HCB program, or consider providing services as a mitigating circumstance for criminal records. Replace a complex screening procedure with more effective risk mitigation. So like instead of screening someone out, maybe partnering with someone in your community who can provide supportive services or case management. And that helps create stable communities by keeping people in housing and not cycling in and out of homelessness. Fourth, housing authorities could streamline their application processes, making it much easier and quicker for someone who is living outside or in some other kind of homeless situation to be able to go through that process a lot more quickly, which also could help them reduce the length of time homeless, which, as you heard Lindsay say, is one of our system-wide performance measurements that everyone in the CoC is going to be measured on. And fifth, create an eviction prevention program. So what are ways that we can help people stay in public housing and not get evicted? We've heard a lot of really great strategies on that from some of our SSVF providers who are working really closely with the VASH program and public housing vouchers, ways that their staff can support the clients and the tenant who are your tenants, and the way that the public housing authorities can support that entire effort. Other promising practices: connect applicants with the security deposit assistance so that that's ready to go and doesn't hold them up from getting into the housing, or creating project-based vouchers, supportive housing with on-site services. and then there's information about more HUD resources. So that is one that I wanted to go through with you because I think it helps clarify what we do, but also if you're going to approach a public housing authority, that's an excellent resource to be able to provide to them. Now I want to go back to the PHA list. We're looking for it. Okay, so that one is the bottom resource. Some more of these at the top are ones that Sophia had referred to. Number 5, opening doors through multifamily housing, a toolkit for implementing a homeless preference. You'll see there are others. CoC and PHA collaboration. Let me just open this one right quick. This is number 1 on the list because I think it's a really excellent overview article. If you're just starting looking into how your local homeless coalition or your community, someone in your community could partner better with your PHA, this is an excellent overview. Walks through what does it mean to do that, what are the benefits of doing that, and literally says, start here. Become familiar with your local PHA's operations and language. And just gives you a step-by-step guide of lots of things to know, lots of questions to ask, lots of links to documents, use your data, how do we work together, all sorts of things like that. And so just let me scroll through the rest of these quickly and you can view them when you're ready. The business case for partnering with public housing agencies, that is what speaks to some people. Well, this document helps you explain the business case. Ending homelessness through housing choice voucher and public housing programs, again, another kind of broader overview. Guidance. I looked through all of these before this webinar, but my brain is a little tired right now and I don't remember exactly what each of these says. But each of them have a slightly different spin on how you can partner with your public housing authority or agency. So we wanted to make sure that you have this set of resources available to you as well. All right. That takes us through our agenda. Thank you for those of you who are still hanging in there with us. I know we present a lot of information in these meetings, and we want to make sure we're getting the material to you and the information that you need to do what you need to do on your level. This is our time for officially questions and answers. So if you have not already asked your question or you've got a new one that's come up and you'd like to ask it, now would be a great time. I do want to point out we have 48 people on the call, which is phenomenal. I'm sure some of you are ESG recipients, ESG subrecipients, CoC program grantees, SSVF grantees, local homeless coalition chairs, service providers, interested parties, people with lived experience. We hope all of you are finding something helpful within the information we're presenting today.
No questions.
All right, there are no questions, so I'll just announce that our next meeting is scheduled for July 27th. Same format, webinar, 2 o'clock. This is a tentative date because if HUD releases the CoC program competition NOFA, and we need to focus on that as a staff and as a CoC, that might mean we do something different for the July meeting. But as of now...
You'll also be at NAH.
Oh, yes, that is true. Cameron, Craig is just reminding me, several of us on staff are going to be at the National Alliance to End Homelessness Conference in Washington, D.C. that week of July. I'd completely forgotten about that. So there will very likely not be a July meeting. We might just send some updates via email, which might work great for you. I know many of your homeless coalitions that I've been talking with, y'all don't meet in July either because it's a very busy time and people are taking summer vacations.
There'll be webinars with grantees, and there'll be TBD dates.
Okay. Cameron let us know that there will be webinars
With grantees for competition.
with
dates?
grantees for competition dates
Or will it be TBD?
to be determined. So if you're not hearing from us, that's a problem. We will be contacting you if you're a CoC program grantee, and we'll be releasing competition-related materials and information as soon as we get them, or as soon as we make them available, if there's something we need to prepare in addition to what HUD has given us, like the RFP specifically. So you will be hearing from us. We may just not have this same kind of meeting next month. But if you're on the email list, you should be getting all of our information anyway. And I think with that, we will conclude the meeting, and we thank you again so much for participating and being a part of our CoC and attending the meeting today. We do encourage you to share the information you learned today with anyone else in your community that might be interested, and specifically with your local homeless coalitions. Also, would love to hear next time we meet if anybody has been able to follow up with their consolidated plan jurisdiction and or their public housing authority if they hadn't already done that. And we'll be getting out the point in time count report soon. And be on the lookout, as Jesus said, for emails from our HMIS team about system-wide performance measurement. Sophia will be working with pilot communities and CoC program grantees on coordinated entry, and everyone will be hearing a lot about the CoC program competition. All right, thank you, and until next time, we hope all goes well. Goodbye.
Bye, everybody.
Bye.